Okay, in this module, we're going to start talking about the principles of wound management. The three principles are to control or eliminate the cause of the wound, provide systemic support to reduce existing and potential cofactors, that is, looking at the whole person. And the third one is to maintain a moist wound healing environment, and that is where we choose what kind of dressing we're going to use. But first, we want to start with the first principle. Control or eliminate the cause of the wound. So the first thing you need to think when you look at a wound is, what caused this? Was it pressure? Has the head of the bed been up, causing shear? Are the caregivers sliding the patient across the bed, or is the patient sliding herself across the bed, causing friction injury? Is the patient diaphoretic or incontinent, causing skin breakdown? Is there a circulatory impairment causing leg ulcers? Does the patient have neuropathy, causing him to be unable to feel his feet? These are just some examples, some of the more common ones. The important thing to remember is that you need to identify the cause first so you can remove it or control it. If you don't do that, none of the rest of the process will do any good. While we are on this slide, I want to quickly address vascular ulcers and the big question, is it venous or is it arterial? If you think about what is going on in both types of impairment, you will remember how to tell the difference. In venous ulcers, there is pooling of blood in the lower extremity due to inadequate valves in the venous system. So with all that extra fluid, as you would expect, venous ulcers are wet. They are shallow, they have beefy red granulation tissue, irregular borders, and what would make sense about the pain? When the leg is down, there is more pressure from the fluid in the leg, so there is more pain. Elevating it decreases the pain. In an arterial ulcer, there isn't enough blood flow, so the ulcer is dry. It is often deep. It has a punched out, pale appearance with very distinct borders. And what about the pain? Well, they already don't have enough circulation in the leg, so what happens if you elevate it? Even less circulation. Elevation causes pain for patients with arterial ulcers. They are the ones who like to keep their legs hanging off the side of the bed. Make sure you can tell the difference since the treatment is very different.